Evidence-based behavioral health, when we pull those guidelines in, we kind of know what's going on in the outpatient setting, or we know what's going on in the inpatient setting. And I think it's that knowledge base that allows us to partner with people. It's a common language, it really is.
And pediatrics, they are now starting, the payers are using the guidelines as a level to drive their care, whereas before they would automatically auth 7 to 10 days, and that is changing. And so now our case manager that is in the biobehavioral unit is having to use the guidelines and show the physicians that as long as the child is no longer suicidal or homicidal, that they can be discharged to a lower level of service with wraparound mental health services.
When you have a set of criteria that give you some level of measurement for what can be a subjective type of documentation, it really kind of gives you more of a leg to stand on because you have a more evidence-based way of creating an argument that's clinically sound.
For substance abuse and alcohol withdrawal and delirium, we do use those. It's a very helpful guideline when they come, because we do get a lot of alcohol and opioid withdrawal. So it's a lot easier to just do one click instead of just having to type everything.
Yeah, and so that makes it
a lot easier, and it's more specific.
Yeah.
To the reason the patient's there for.
I can tell you, for the small facility that we did, I mean, they do the best. They had the best UR program for psych in the whole system. So they were the first ones to really ask for it. And so I've worked with them a little bit, and I know that they use it on every case, and it's been invaluable to them, because psych's very complicated, and you've got to, especially when it comes to when they're ready for discharge. And you really, from what I've been told by that team member, there's a lot of tools in the behavioral health guidelines that help you establish when they're ready for that next level of care, because really most of the denials we get in our psych units are continued stay, where the payer's saying, well, they could have left before they did, and we're not going to pay you for those days. So we use, I know she uses the behavioral health criteria and those next level of care, the parts that help you evaluate that, to make those cases and say, no, we could not establish this, this, and this per the criteria, so no, they were not safe to discharge. And we have a very good overturn rate with those.